Simon is 27. He lives with his mum and younger sister in Highgate. He went to school in Birmingham and in 2000 started a degree in business studies. Unfortunately, after the first term, he began to fall behind with his work, leading him to feeling very stressed and anxious. He began not to attend his course or see any of his friends, preferring to spend long periods alone in his bedroom. His mum began to really worry about him when he stopped sleeping at night, and she could hear him shouting at people who weren't there. He also told his mum that people were following him. Simon was referred to the community mental health team after going with his mum to see his GP. He has had an assessment of his needs undertaken by Anne, who is his care coordinator. Simon was able to tell her that he did feel quite lonely, and when he doesn't hear the voices, he thinks about his course and how he used to enjoy the buzz of university. Anne had read about the Day Opportunities service and felt it might be able to help Simon with his loneliness. So she contacted the service and arranged for someone to come and tell Simon more. A quick call to the Day Opportunities clarifies the referral criteria and the necessary paperwork required. The manager of the Day Opportunities service, Asha, explains about the service to Simon at a meeting with his care coordinator. Our team of support, time and recovery workers use person-centred ways of working to help with you to identify what is needed to support your recovery. What that really means is that they ask you about the kind of things you like to do, used to do and miss doing now, as well as helping you to say what else you need. Support, time and recovery workers would then work with you to write an action plan about how you may achieve your goals. It may be that through the person-centred working, you may say you would really like to meet other people again, but the thought of it worries you. So your support, time and recovery worker will come with you to have a look at a few options around the city, so that you can decide which one feels good to you. You may need some help to get the confidence back to use public transport, and again, the support, time and recovery worker can help you with this. Simon thinks that it sounds like a good service, but is worried that he will be pushed into activities he doesn't want to do. For example, will I be forced into working? He is reassured that this service is person-centred, which means Simon is the person who decides what is best for him, and is supported by trained staff to reach the goals that he sets for himself. "Okay," says Simon, "I'll give it a go." Asha, the manager, tells Simon about the next stage and what he can expect from the service. She asks him if he would prefer to meet the support, time and recovery worker at home. He agrees to this and says he would feel more relaxed at home. Simon meets with Derek, the support, time and recovery worker, and they begin to work together. They start by just chatting at home, and then gradually Simon agrees to go out for a walk and then to meet at the local cafe. Over the next few weeks, Derek is able to get Simon to tell him more about himself and what he would like to achieve. Derek and Simon work together to put an action plan together. Because he is quite lonely, Simon wants to meet more people, but without having to disclose his mental health difficulties. Derek introduces him to the resource hub, where Simon immediately feels welcomed by the other people who have been through similar experiences to himself. Simon thinks he'll come for a coffee next week and see what it can offer him. Simon and Derek continue to meet each other each week for an hour or so to work on the goals on the action plan. To make sure Simon is happy with the way things are going, and to ensure that the service is working towards his goals, a review is held every few weeks. Anne, Simon's care coordinator, is invited to attend by Simon, and Simon asks his mum to come along too. They all agree that Simon's confidence has developed, and he is beginning to look to the future with more positivity. There has been times when Derek has had to contact Anne, Simon's care coordinator, with Simon's permission, when he has begun to feel anxious and has stayed in his room for days on end. Anne has helped Simon to ask for support when he thinks he needs it. Simon continued to develop his confidence, and after 4 months of working with Derek has met regularly for a coffee at the resource hub once a week. He's gone to the City College for an open day to look at possible options, and he's gone into town on the bus each month to buy CDs, twice with Derek and once on his own. He started to attend a football project at Star City. Simon has taken a keen interest in the resource hub and thinks it could do more to encourage younger people like himself to get involved. Derek puts him in touch with a volunteer and a support time and recovery worker who help Simon to look at volunteering at the hub. After 7 months, Simon feels he has reached his goals. He now volunteers twice a week at the resource hub and will be starting an access course in September at his local college. He's decided to keep in touch with Derek by phone. He now feels that he would prefer to see Derek every month for the next 3 months.